everyone, and welcome to day 2 of Be a Jewish Upstander, a call to action on supporting immigrants and refugees during COVID-19. I'm Max Potashnik, the Director of Government and Community Relations for the Jewish Federation of Greater Seattle, and it's a pleasure to have you with us today. If you missed yesterday with Rabbi Seth Goldstein, in which we talked about Jewish values, Jewish text, and Jewish history as to why we should be supporting immigrants and refugees, our call to become part of the action to save lives and to become part of the solution, you can check it out at jewishinseattle.org. There will be an email that will go out that will have our landing page on it, and it will be continue to be updated with resources and actions throughout the week. So again, yesterday we heard from Rabbi Seth Goldstein. Today we're going to have the pleasure of hearing from Tamid Gilden, who's a Senior Policy Associate for the Jewish Council for Public Affairs. Tomorrow we're going to be hearing about state advocacy with Jorge Barón from the Northwest Immigrants' Rights Project. And Thursday we'll be hearing from Cordelia Revels, who's the Director of Immigrant and Refugee Services for our local Jewish Family Service. And on Friday, we'll have the pleasure of hearing from Andrea Sirocco-Nar from the Jewish Coalition for Immigrant Justice Northwest, who is advocating and organizing here in the Jewish community. And before I continue, I wanted to take a moment to thank our Federation donors for making the work possible that we do, this programming and all programming. And I also wanted to take a moment to thank our generous and large list of co-sponsors, the ADL Pacific Northwest, Beth Alef Meditative Synagogue, Beth Chaverim, Congregation Beth Shalom, Herzl-Ner Tamid, IAC Seattle, J Street, Jconnect, JCIJ Northwest, the Jewish Coalition for Immigrant Justice Northwest, Jewish Family Service, Kavana Cooperative, Seattle Hadassah, Secular Jewish Circle of Puget Sound, Temple Beth Am, Temple Beth El, Temple Beth Hatfiloh, Temple Beth Or, Temple to Hirsch Sinai, and last but not least, the Washington State Jewish Historical Society. We are certainly stronger together and stronger with all of you together, learning about and advocating for immigrant and refugee communities. So now, before we move forward, I just want to tell you a little bit about Tammy. She is the Senior Policy Associate at the Jewish Council for Public Affairs. She develops, implements, and manages JCPA's domestic and international policy programming and advocacy strategy. Her main areas of expertise are international human rights, immigration and refugees, civil rights, criminal justice, transportation, science, nutrition, and climate and energy policy. I hate to say, or I guess I shouldn't hate to say, there's pretty much nothing you don't cover, Tammy, really a woman of all trades and an expert. So it's a pleasure to have you here with us today. And just a reminder to folks on the line, if you would like to ask a question during the webinar, we'll try and get to one or two during this time. We will stop promptly at 12:30. We want to be timely, but we'll try and get to those questions. So if you have a question, please type it in the Q&A box and we'll get to it as soon as possible. So with that, welcome Tammy, and I'd love to start off with you telling us a little bit about what is JCPA and what is the work that you all do supporting immigrant and refugee communities.
Thank you so much, Matt. And before I get started, I just want to say thank you so much for doing this entire program. It's incredible, and thank you so much for having me, and to all of you for tuning in today. So if you're not familiar with JCPA, we're the national umbrella body of 125 local Jewish community relations councils all around the country. And we also represent 17 national Jewish agencies, including the 4 denominations of American Judaism. Together, our network advocates for just and pluralistic American society, human rights around the world, and also, of course, support for peace and security in Israel. So JCPA has prioritized immigration reform since 1946 with the fight to repeal the racist national origin quotas, which kept out many Jews, including those fleeing the Holocaust, as well as other quote unquote undesirable immigrants. Over the next several decades, JCPA pushed for legislation to increase legal immigration, support newcomers, and provide a safe haven to refugees. In the mid-2000s, like many of our organizations, we worked for comprehensive immigration reform, which of course to this day has not yet come to fruition. Over the past several years, we really renewed our commitment to compassionate immigration reform in today's worsening crisis. Over the last couple of years, we've held 2 lobby days for top JCPA leaders to advocate with Congress on our top immigration priorities. We've also increased our legal advocacy, so filing joint amicus briefs opposing every iteration of the Muslim travel bans. We've advocated for dreamers and those with temporary protected status, as well as for higher refugee admissions. At the same time, we've been doing all of this while fighting to end family separation and detention, the overwhelming criminalization of migrants and asylum seekers, and to really prevent the rollback of child health and welfare standards for those in US custody. And then we've also worked to defeat a number of anti-immigrant bills that have conflicted with our core policy and values. So our work falls into a few main buckets. We have our coalition work. In immigration, we work in two main areas, or two main coalitions, excuse me. One is an interfaith immigration coalition, and the other is a secular immigration coalition that houses about, I think, 200 different civil rights and immigrant rights groups. And that's really how we stay in touch with what our immigrant communities and organizations are advocating for and what they need from us, and ensuring that we really hew closely to what they're asking for and make sure that all of our advocacy and actions are really staying true to what they feel is best for their communities. And this is also how we do a lot of our legislative work. So aside from our advocacy days or actions that we take specifically for the Jewish community, we work with our coalitions to weigh in with legislators on, immigration bills or bills that affect immigrants. We submit statements or testimony to congressional committees when it's relevant or helpful. And then increasingly, we also weigh in with the administration on regulatory rules. So think changes to our regulatory system that would harm immigrants or undermine the immigration system. And like I mentioned earlier, JCPA has also increased its legal work over the last several years as it's been more difficult to push legislation through Congress. And we've also seen sort of a record number of regulatory changes that have been challenged in court. So we've increased the number of amicus briefs we sign on to, which are statements advocating for a particular position that we file with the federal courts. And for the first time ever in JCPA's 75-year history, we actually were a plaintiff in a lawsuit that we filed challenging the public charge rule. So for those of you who aren't familiar with the public charge rule, it essentially allows the federal government to consider previously excluded health and nutrition programs in public charge determinations. And so that's where they decide whether or not a new immigrant, when they're looking at the application, whether they're going to be a public charge, whether they're going to become reliant on the federal government for support. And this, since it was first introduced decades ago, it's really been narrowly tailored just to those who would really become pretty much wholly dependent on the government. And so this is a drastic shift from past precedent. And in addition, the changes allow the federal government to not just take into account use of programs by the immigrant themselves, but also by US children and other family members. So someone whose child receives free or reduced price lunches, for example, could have that weighed against their citizenship application. And then of course, a huge part of JCPA's work all throughout the year is our educational campaigns. So we put out explainers on different issues, webinars, and we hold a 3-day conference every year where we bring speakers. And immigration has been one of our top priorities for the last several years. So we've had numerous opportunities for engagement. And then as much as possible, we try to support our JCRCs, like Max in Seattle and the work that they do with immigrant groups all around the country.
Thanks so much, Tammy. And we certainly do rely on JCPA and their work on national coalitions to guide our policy and our work here, federations and Jewish community relations councils across the country, because we don't always have time to develop comprehensive, thoughtful policies on, say, for example, immigration. So we're able to participate in the creation of that policy on a national level and bring it back home here. Tammy, in addition to all the work that you spoke about, really comprehensive and deep and broad, we're really appreciative that you can represent the Jewish community so thoughtfully and extensively on the national level. I know you had the opportunity last August to go down to the US-Mexico border and bear witness to some of the things that were happening down there. And I was wondering if you could tell us a little bit about what you saw, what you learned, and then we'll talk a little bit more about what the situation looks like today.
Absolutely. So JCPA led an intensive 3-day fact-finding trip to the Arizona-Mexico border last August. And we really did that to examine US policies from different perspectives and witness the conditions facing migrants and asylum seekers firsthand. With the goal of better understanding the factors driving the humanitarian crisis at the border, and also to inform our advocacy so that we can be more effective in our own work. So we wanted to give our participants a really comprehensive look at the issues from different perspectives. So among the different activities that we did, we visited the Mexican consulate, we walked along the Arizona-Mexico border, and we actually did that accompanied by a border militarization expert who's written several books. We toured shelters for asylum seekers on both sides of the border, which I think was probably one of the most meaningful experiences for trip participants. But we also learned from Border Patrol about their current policies, processes, and challenges. And then finally, we witnessed an Operation Streamline hearing, which is a federal program that fast tracks criminal prosecution and deportation of migrants who are caught entering or crossing the border between ports of entry. So that's traditionally, in the past, it wasn't asylum seekers, but as avenues for legal immigration have been closed, we've seen an increasing number of asylum seekers who are attempting to cross simply because they're so desperate. So I think one of the things that visiting this region really made clear or really highlighted for us was just how ever present the ramifications of our border policy are for these border communities and the entire region. And just how much the current crisis that we're seeing today is a result of decades of misguided, but also bipartisan directives that have just been layered on top of each other to create this really confusing and counterproductive web of policies. Like I said, we visited with asylum seekers on both sides of the border and got to hear their stories. And I think it was really meaningful and also helpful for participants to really understand the process that asylum seekers have to navigate when they try to seek asylum from the US. So one of the new policies that we've seen under this administration is what's known as Remain in Mexico, or the Migrant Protection Protocols, or MPP. So if you've heard that term thrown around, what it really means is that we've decided that we're going to sort of bottleneck asylum seekers who come to the border, which again, it's a legal process. They're not violating any law. It's protected under both international and domestic law, the right to seek asylum. So they come to the border and they say, I'd like to seek asylum. And they're basically put into a queue and forced to remain for several months on the Mexico side of the border, just to wait for the opportunity to come back and be allowed into the United States to adjudicate their case. And actually what we've seen is in many cases now they're being forced to, so that's metering, I apologize. And then the Remain in Mexico policy forces them, once they have gone to the border and been allowed to make their case, to then remain in Mexico while they wait for the adjudication of their claim. So we've never seen this under any other administration, and that's created a real mess on the Mexico side of the border, where shelters are scrambling to take care of all these people. And we're talking about very vulnerable populations and many children as well who have experienced a lot of trauma. So again, the bottlenecking of asylum seekers and forcing them to wait before they can even make their claim is called metering. So I apologize for the misuse of the term. And then of course, I think Operation Streamline was, so I witnessed this now twice, and I will never get over the experience. It fast tracks the criminal prosecution and deportation, again, of those caught between ports of entry, but it puts them into mass trials. So for us, we observed 67 men and women who were all shackled in chains from their ankles to their waists to their wrists. So that's a 3-point shackling, similar to what you would have seen during the slave trade. And they're all tried and sentenced and then scheduled for deportation within about 40 minutes. And I think the sound of the clanking of the shackles is something that I know I will always remember. And I think hearing from our participants, that was one of the things that struck them most.
Thank you for sharing that. Sounds like a really, really powerful experience. It definitely gave me chills while you were speaking about it.
And it's something that we would love to do again. We were hoping to do one again this year before the COVID-19 crisis, but if we had the opportunity, we would love to take more community members.
Thank you. Thanks so much. And, you know, with what you saw last August, and as you mentioned, you'd like to do another trip, but, you know, now things have changed. I was wondering if you could talk about what is the current situation for immigrant and refugee communities across the country in terms of what things have really jumped to the forefront as the greatest area of need. Are there some things that have fallen back in terms of priority list? How do you all see the picture, and how do you prioritize what are the greatest needs right now with COVID-19?
So I can talk about kind of two things. I can talk about sort of the issues that were already facing immigrants, and I can talk about what's sort of new with COVID-19, because I think they're actually pretty intertwined. I mean, I think with COVID-19, what we're really seeing is an extension of the problems that already existed that are now made more dire by this crisis. So, you know, as we talked about before, immigrants and refugees have been facing tremendous challenges even outside of this COVID-19 crisis. Decades in the making, but this administration has really instituted a number of changes to US immigration policy that have really had far-flung impacts. So separating children as a result of criminally prosecuting first-time border crossers and families, significantly reducing overall refugee admissions, restricting entry for refugees from predominantly Muslim countries, and expanding detention for immigrants and asylum seekers, as well as now blocking access to asylum altogether. So right now, it's much harder to apply for asylum, to be resettled as a refugee, or to obtain any sort of legal immigrant status. And in addition, the administration has also sought to crack down on immigrant populations that already have legal status and are residing in the United States, such as revoking or refusing to renew those with temporary protected status. So temporary protected status is a temporary immigration status that is provided to people whose home countries are experiencing problems that make it difficult or unsafe for them to be returned, or for them to go back or be deported there. So think countries like Yemen, Haiti, El Salvador, Sudan, Nigeria, Syria, places with where we're getting lots of refugees, actually, people who are really fleeing horrific conditions like war or an environmental disaster. So TPS has really been a lifeline to hundreds of thousands of individuals that are already in the United States when these issues arrive. And for many of these people, they've been living in the United States for decades. They have careers, they have families, including US relatives, and in many instances, US children. I think it's something like 250,000 US children are the children of those with temporary protected status.
Wow.
So we've also seen DACA recipients be targeted. They are also at risk, as we're likely to see a negative Supreme Court ruling in the next few weeks or a few months. And that would place hundreds of thousands of young people at risk of detention and deportation, many of whom are actually on the front lines of this crisis. So when legal immigrants are applying for a renewal or extension of their application or their status, we've actually seen their status revoked or denied due to minor offenses that happened years ago. So for example, shoplifting or smoking marijuana as a young adult and getting a criminal charge for that. So we've seen a real increase in these types of deportations, as well as for undocumented immigrants that really pose no threat. But I should note that this is really, we talked about family separation at the border, but this is really family separation in another form that's been going on for decades. And they actually first really skyrocketed under President Obama, for which he really faced heavy criticism from the immigrant rights community. Mm-hmm. At the same time, we've been cutting refugee resettlement from, I think, 95,000 to, I think it's 28,000 now. which is an all-time low, despite the fact that the need for refugee resettlement has never been greater. And of course, blanketing all of this, at the same time, we've seen xenophobia rise consistently over the last several years, and especially around this crisis.
Tammy, could you talk a little bit more about the way COVID-19 has particularly impacted both deportation as well as the family separation and detention issue, why those have really come to the forefront right now?
Sure. So I'll talk a little bit more expansively than that, just because the issues are sort of even greater than those. I mean, I think those are very dire, but at the same time, around COVID-19, I think the issues have shifted just a little bit. But again, the needs haven't changed so much as they've become more dire. And as will the ripple effects on society if we don't take action to protect these populations. So first of all, many immigrants and refugees have been totally excluded from the health and economic supports of the COVID-19 bills, as have their families in some cases. In addition, they are overrepresented in essential jobs as healthcare workers, farm workers, in the food industry, et cetera, meaning that they are in need of both political and physical protection in terms of workplace safety and personal protective equipment. They're also often employed in sectors of the economy that have been hardest hit economically and have few options for support. So for example, in restaurants, service jobs, hospitality, construction, and other similar fields, which means they're even more vulnerable to an economic recession than the average American, who has access to at least some governmental support. Mm-hmm. So for example, in the last economic stimulus bill, the third package, Congress made it so that a US citizen with a spouse that files with an individual taxpayer identification number would be ineligible for the cash payments, as well as obviously the spouse. So this actually leaves out a lot of legal immigrants, such as those with temporary protected status, DACA recipients, and others with special legal status. And not only does it make that person ineligible, but it actually makes the entire household ineligible to receive any kind of economic support. Mm. So we're also seeing, and this gets back to your question about deportations and other types of enforcement, they're also facing barriers to accessing health care due to continued and even in some cases increased immigration enforcement activities like checkpoints around the border region, which can extend 100 miles into the United States from any border, as well as ICE raids and deportations, which make communities fearful of seeking treatment or testing. And it also, in the case of deportations, can actually spread the virus and expose more US personnel to the virus. In addition, many families are actually what's known as mixed status, which means they include a number of different types of immigrants. So for example, you might have a grandma or grandparent with TPS, with a DACA child, and a US citizen sibling, for example. So this actually prevents many of those households from accessing any kind of support. And then of course, with detention, COVID-19 is spreading like wildfire among those in US custody, where they already lack access to basic care, and death in custody is increasingly common for reasons entirely unrelated to COVID-19. But as the weeks go by, we'll see an increase in those deaths as well. So with the spread of COVID-19, it's really imperative that we reduce the detained population drastically to avoid a humanitarian catastrophe. Similarly to prisons and jails, there's both a humanitarian and a utilitarian concern for COVID-19, as it endangers both the detainees and the nearby communities that staff these facilities. So I'm happy to expand on any of those points, but I know we have limited time, and I could go on and on and on about the different issues that are being raised by this virus and how it makes communities, particularly immigrant communities, more vulnerable.
Thank you. Yes, there is so much to cover. And I think, one of the pieces that we really wanted to focus on this week was to give people an opportunity from home, where most of us are sheltering in place, to take action. So I was hoping that you could take us through the action items that JCPA would recommend that when we contact our members of Congress. And we've got these broken up into 2 slides, just so you know.
Oh, great. Okay. So as Max said, I'll focus on congressional actions because I think tomorrow you guys are going to be talking about local and regional actions that you can take, which are so important. I cannot state that enough, how important they are. So I highly recommend you tune in tomorrow. But I think the single most important issue that Congress can address right now is to provide immigrant communities with access to health and economic stimulus measures that they've been left out of. I mean, really, they should be providing everyone with free testing and treatment, but now we're specifically talking about the immigrant and refugee community, which have been left out of a lot of these measures. So this includes eliminating the immigrant restrictions on the Medicaid state option for COVID-19 testing and treatment. There are numerous provisions of law that restrict immigrants' ability to access Medicaid, which is really restricted to quote unquote qualified immigrants, which is defined as including green card holders, refugees, and other asylum seekers. So undocumented immigrants, people with DACA or TPS holders, and others with special immigrant status are not included in any of those provisions and cannot access Medicaid. And then even for those who are qualified, they're actually banned for the first 5 years that they're here from accessing Medicaid. And there are some exceptions to that, but coronavirus testing does not meet the statutory definition of an emergency service. And I think failure to address this problem is really going to impact millions of people. It's going to undermine our efforts to contain the virus, and it's going to put a real strain on providers and states who are going to be stuck with uncompensated care costs at a time when they're particularly vulnerable. The other piece on the economic side is the issue I talked about earlier, which is allowing individuals who file taxes with what's known as an ITIN, or individual taxpayer identification number, to receive cash payments in addition to those with social security numbers. And also to clarify that refugees, asylees, and special immigrant visa recipients are also eligible for these supports. And if you want, I can talk about why these payments are so important, but I know we're running very short on time. So I think the other recommended actions or asks of Congress that we're urging you to make are sort of self-explanatory, but wanted to leave time for maybe a couple minutes of questions.
Okay. Unfortunately, we don't have any time for questions.
I'm so sorry. I'm so sorry, everyone.
Nothing to apologize for. I think that is, one of the most challenging pieces of this work is that there is so much to cover. There's so many avenues where help and assistance and advocacy are needed. So if you did go ahead and type a question in the Q&A box, I'll make sure that we can get back to you in a timely manner. I also wanted to share that as per yesterday, when the webinar is concluded, there'll be a survey that pops up in your browser, and we would be so grateful if you would complete that to let us know how we can continue to improve. All of the action items that Tammy talked about are going to be sent in a follow-up email. They'll also be on our landing page at jewishinseattle.org, so you can go ahead and read more about those and learn how you can get in touch with your elected officials and go ahead and advocate on these policies. May not be last, let's see how many more things are on my list, but I did want to go ahead and give another thank you both to the generous donors of the Jewish Federation for making programs like this possible and continuing to support our work, as well as to our extensive list of co-sponsors for helping us learn and take action and engage with your communities in this time where it is often so hard to connect with others. And tomorrow, don't forget to tune in again at 12 p.m. where we'll be hearing from Jorge Barone from the Northwest Immigrants' Rights Project about advocacy efforts here in Washington State. And with that, just thank you so much, Tammy. It was a really informative and wonderful presentation. Again, if you had questions that didn't get answered, we'll get to you. And if you would like to get in touch with us because questions come to you later, please go ahead and reach out to us at jewishinseattle.org. Thanks so much, everyone. Have a great afternoon.
Thank you so much for inviting me to speak.